So after that, the next medication is clindamycin. So clindamycin is an antibiotic. It's specifically for your anaerobics. It's targeting your anaerobics of gram-positive or gram-negative, but make sure you know that it's definitely outside of the CNS. It's located out of the side of the CNS. There'll be other antibiotics that I would think would be used for that. It inhibits protein synthesis of bacteria, which all the ones we actually are learning this time has to do with that. So, yeah. Okay. I think it's also important to know that clindamycin was considered category, let me check for a second. It says category A actually, but I don't know if I trust it. All right, so it says mainly the main thing that I know that you should know is do not use with clindamycin with erythromycin. Like, definitely don't use those two together. Erythromycin, clindamycin, and there's this other one called chloramphenicol, which I don't know about, but it says that in the textbook as well. And if you want to know where it is in the textbook, it is clindamycin is on page 1042. So it's in like this antibiotic section of the textbook. It's in chapter 86, talking about bacteriostatics. So yeah, it's other bacteriostatics inhibitors of protein synthesis. So it's similar to erythromycin. It does a similar effect of inhibiting your protein synthesis. So chapter 86 on page 1042 again. All right, so you do not want to use this with erythromycin, clindamycin. It antagonizes the fact they don't work together. They don't really help each other in any way because they're literally just don't work together. You can find these orally, IM, or IV. So the main thing I want you to take away from this is clindamycin starts with C, Clostridium difficile associated diarrhea, and also known as, it used to be called your antibiotic associated pseudomembranous colitis. All right. So what is the nurse going to be looking for? The nurse is going to need a report. If they see 5 or more watery stools, report that to the physician, because that means that you're expecting that they probably have C. diff by that point. But really what qualifies it as C. diff is technically you'd be probably seeing like 10 to 20 watery stools a day. You're going to get that abdomen pain. It's going to hurt. I know my grandmother had C. diff. It was terrible. Lots of pain. You may have fever, leukocytosis. Your immune system's just breaking down on you. If your patient does have C. diff, what you're going to want to do is, for these patients, is you're going to just want to discontinue this drug immediately. It's going to cease in like 3 to 5 days is what it says in the textbook. The watery stools are going to cease, and usually they're replaced with like vancomycin or some other medication. And also make sure you replace those fluid and electrolytes that they lost through their diarrhea. You definitely do not want to use this drug, C. diff, other drugs like opioids, or like, let's say they have abdominal pain. They may want to have opioids or something to relieve that pain. Well, they really should not have, because that decreases bowel motility, and they're having diarrhea and they're having problems. They want to release that bacteria. And also anticholinergics. So these are the 2 kinds of medications that will slow down your bowel motility. All right, so this is considered a class A of, according to what I have on my mind map. I don't know if that's true, and in the textbook it doesn't really say anything. The main takeaway from this is, I'm pretty sure C. diff. I'm seeing what it says in our, it's only like 2 slides, and literally it just talks about like pediatrics. It says clindamycin belongs to the drug category antibiotic therapy. When monitoring a pediatric patient using clindamycin, what side effects should the nurse report to the physician for potential complications? And they just focus on pseudomembranous colitis. A potential complication of clindamycin, therefore diarrhea, should be reported to the physician for further assessment. Well, that's pretty common sense, and they're really not talking about just pediatrics. So, yeah. So really monitor for your CDAD, which stands for Clostridium difficile associated diarrhea. All right, C for C, clindamycin for Clostridium. All right, so that's your clindamycin look for those watery stools, that abdominal pain, your fever, your leukocytosis. All right. Love y'all.